Good evening. It's Monday, May 24, 2021 here in Cebu City. I'm Cherry Ann Lim and this is SunStar Tonight. The Cebu Provincial Government has entered into an agreement with a private health insurer to enable employees in the private sector to avail of services in capital-owned hospitals. Shari Coronel reports.
The Cebu Provincial Government has tapped Health Maintenance Organization or HMO CareHealth Plus Systems International Incorporated to be the accredited health insurer in its hospitals. Capital manages 16 provincial and district hospitals. In a Sugbo News report, Governor Gwendolyn Garcia signed a memorandum of agreement with CareHealth and state-run Philippine Health Insurance Corporation last week, May 19. Based on Sugbo News report, the accreditation involves an investment of 200,000 pesos cash bond from CareHealth, which will be returned to the company upon the termination of the contract. With this development, the provincial and district hospitals can now cater to patients in the private sector who are covered by an HMO on top of their field health coverage. This is the first time a provincial government has accredited a private health insurer in hospitals that it owns and manages. In the past, due to non-accreditation of HMOs, these private sector patients could not be referred to or confined in capital-owned hospitals as they need to be admitted to hospitals which have agreement with HMOs. Based on the MOA, members of the CareHealth and their dependents can avail themselves of emergency consultation and treatment, outpatient services, and medical and surgical inpatient services in capital-owned hospitals. Chari Coronel, SunStar Tonight.
Aspiring physicians can now take up a medical degree for free. The Cebu Normal University, in partnership with the Vicente Sotto Memorial Medical Center, will start receiving applications for Doctor of Medicine on June 1. Kenneth Torres reports.
The Cebu Normal University, in partnership with Vicente Sotto Memorial Medical Center, will have its own College of Medicine. The university will start accepting application for Doctor of Medicine on June 1 to 25. CNU Officer in Charge President Dr. Filomena Dayagbil clarified that deserving applicants with middle and low family income will be prioritized in the program. Commission on Higher Education Chairman Dr. Prospero de Vera III said that the program is under the Doktor Para sa Bayan Act or the Republic Act 11509, which President Rodrigo Duterte signed last December 23, 2020. This is to establish a medical scholarship and return service program for deserving students in state universities and colleges or in partner private higher education institutions in regions where no state colleges and universities offer a medical course. Under the Medical Scholarship and Return Service Program, students will have free tuition and other fees, allowance for prescribed books, supplies and equipment, clothing or uniform allowance, financial assistance during the mandatory internship, medical board review fees, and other education-related miscellaneous. Dayagbil said that the school will only open one section with 40 students for this school year. Applicants must have outstanding scholastic record from a bachelor's degree in a field relevant to health from a college or university duly recognized by CHED. The program hopes to answer the shortage of doctors in the country, especially in rural areas. The CNU-VSMMC College of Medicine will be located at the VSMMC compound. Kenneth Torres, SunStar Tonight.
The Cebu City Emergency Operations Center has noted an increase in the number of active COVID-19 cases in the city in the past few days. Chari Coronel reports.
Data from the Cebu City Emergency Operations Center or EOC showed that the active cases of the coronavirus disease have been increasing in the past 3 to 4 days. On May 23, the active cases in the city rose to 380. City Councilor Joel Garganera, the EOC Deputy Chief Implementer, said non-compliance to the minimum health standard contributed to the increasing active cases. Garganera added 73% of those who tested positive for COVID-19 reportedly did not wear face masks around with other people. Last week, the city's active cases fell below 300. The EOC only recorded 263 active cases on May 18. Authorities reminded the public to follow health protocols until herd immunity is achieved. The total COVID-19 cases in Cebu City reached 24,068 as of May 23. The total positivity rate was at 8.87% out of the 271,199 individuals tested. Chari Coronel, SunStar Tonight.
Disability or death due to injury sustained while working from home is now compensable under the Employees Compensation Program. Kenneth Torres reports.
Employees who will suffer from disability or death due to injuries sustained while working from home may now avail themselves of benefits. In a statement, the Employees Compensation Commission or ECC Executive Director Stella Zipagan Banawi said the ECC Governing Board has approved Board Resolution 21-03-09, which puts work from home disabilities and deaths under the Employees Compensation Program. Banawis said that employees working from home are not exempted from possible work-connected disabilities or deaths. She added the decision is based on their bid to ensure that the ECP will remain relevant and responsive to the needs of workers amid the pandemic. Under the ECP, workers who suffer from work-related sickness, injury, or death are entitled to the benefits such as loss of income, medical and death and funeral benefits. Last April, the ECC added COVID-19 to its list of occupational and work-related diseases that are compensable under the ECP. Kenneth Torres, SunStar Tonight.
To get the latest, visit www.sunstar.com.ph. Follow us on our YouTube channel and official social media accounts on Twitter and Facebook. I'm Cherry Ann Lim. Thanks for watching SunStar Tonight. See you again tomorrow. Good night.